Hey, Dr. Tyler Williams with Pinecrest Dental, and you're here today because you have some questions about bad breath and how it's affecting you and maybe your lifestyle or your social situations or your partner, spouse, boyfriend, girlfriend. So I want to take a minute and share some things that we found helpful that could also help you in getting a nice smile. Okay, so there are kind of three main areas that we typically look at that will help you get better breath. So the first one is obvious, or a little more obvious for many people, which is the health and condition of your teeth, right? So if you have cavities, gingivitis, gum disease, chipped teeth, cracked teeth, old root canals that are discolored, those kind of things, those are like sponges for bacteria, and so that bacteria sits in your teeth and you can't floss it out, you can't brush it out because it hides in those cracks. Now, all bacteria in your mouth is not bad. There's a lot of good bacteria that's supposed to be in there, but the bacteria that likes to hide in those cracks and those cavities and those small places in your teeth is usually the bad kind that causes, your teeth to rot or gum disease, those kind of things. And so if you've noticed, pitting on your teeth, discoloration, you've had tons of cavities at the dentist, broken teeth, crowns, root canals, then it's a good chance that you have a high amount of bacteria, and I'll share with you in a minute how to find that out. But getting those things taken care of, that's kind of your first one, right? Your second one is the health of your tongue, all right? So some studies have been done that show, when you have a lot of bacteria in your tongue, or your tongue's not clean, that you're actually, more likely to get colds, flus, and sickness, okay? And of course, bad breath. So we recommend using a tongue scraper. I use one once a day, every morning when I get up. And there are different kinds you can use. Toothbrush bristles are okay, but they're not great. If you've used a tongue scraper or you start to use one, you'll see a huge difference between what comes off of a tongue scraper versus what you may or may not see with a toothbrush. And basically, these are like a big squeegee for your tongue, and you'll kind of, the kind I like to use have two sides, and they're copper, and you hold on the back of your tongue and just squeegee that off. It's almost like squeegeeing, your garage floor or a window, and you'll see all this white and yellow kind of foamy, slimy liquid stuff, which I know is pretty gross. Again, not all of it's bad, but a lot of it is, and a lot of it causes the bad taste, bad breath, more likely to get cavities, because our tongues are almost like a sponge. So by doing that, not only will you have fresher breath, but you're also less likely to get cold and flus, according to some studies. Another way to do that on your tongue is to use an oral probiotic. These are not the kind for your digestive system, they're for your mouth. They help put more of the good bacteria in your mouth. So if you think about like live active cultures that are in yogurt or probiotics or acidophilus, those kind of things for your body, these ones are formulated specifically for your mouth and the environment of your mouth, and that helps you get that better. Get your breath better. Okay, so we've talked about so far the health of your teeth is one, teeth and mouth. Two would be your tongue. Okay, and the third one is your saliva. So with your saliva, there's a lot of different components to that. We have some really cool new technology you've probably never had done, and it's saliva testing. And basically, all you have to do for that is spit into a cup, and then we sample it, analyze it for you. It gives about 8 or 9 different readings and tests. So if you think about when you go get a physical, you get your blood drawn and they run a panel and they look at a whole bunch of different markers and measurements on your blood, right? Checks, levels of hormones, vitamins, deficiencies, iron, those kind of things. Well, we found it's helpful to do the same thing for your spit. And so we have this special computer that will analyze your spit, and it gives us a bunch of different readings, and then we share those with our patients. So it looks at things like levels of odor-causing ammonia, which can lead to bad breath. It measures how much bad bacteria you have in your mouth versus good, which again can cause bad breath. It measures things like proteins, red blood cells, white blood cells. Those do get in your spit, especially if you have gingivitis or you have irritation in your mouth, or you have old dental work where your gums are red and they bleed a lot, or it bleeds when you floss, you're going to have blood that's oozing out into your spit. And even though it may not be red, we're going to find that on that saliva test. That's been really eye-opening. You know, we have patients coming in saying, oh, that's really great because I just had some blood work done and that matches a lot what was being said there. So it's helping us better understand the correlations to help you out and make those better. So if you have some more questions on this, please let us know. But, you know, getting your new smile and getting, you know, nice bright smile, all your teeth renewed or replaced is a great start to getting better breath. And then use some of these tips that we've shared. And we'd love to hear your success stories. Please share them in the comments below. It's one of our favorite things is to hear back from our patients with how happy they are with their new smile or overcoming bad breath or sensitive teeth. So let us know how it goes, and we look forward to seeing you on the next one. Have a great day.